Namaskar. I'm Dr. Richa Thukral, Senior Consultant Pediatrics and Neonatology at Apollo Hospitals, Noida. Today, I'll be speaking to you about how to prevent anemia in children. Now, all over the world, February 13 is celebrated as the World Anemia Awareness Day. And 13 is the ideal number that your hemoglobin level should be. So, what do we mean by anemia? Anemia is a decrease in the number of red blood cells or decrease in the hemoglobin concentration of your blood so that it is not able to supply adequate amount of oxygen to all the tissues and organs of the body. The ideal hemoglobin level in adult males should be 13 grams per deciliter, and in children and women it should be 12 grams per deciliter. So if we look at the prevalence of anemia in India, it is a huge percentage of population which is anemic. Almost 60 to 70% children are anemic in India, both in rural as well as urban areas. Also, the prevalence of anemia in women in reproductive age group and in pregnant women has been found to be about 50 to 60%. So this poses a huge socioeconomic burden on the country. It leads to increased maternal and childhood morbidity and mortality. Also, it decreases the productivity of the population. So if we see what are the causes of anemia, then the most important reason is the inadequate nutrition, what we call as nutritional anemias. And the major cause of nutritional anemias is iron deficiency. Also, deficiencies of folic acid and B12 can also lead to anemias. Now, what are the symptoms of anemia that we see in children? In children, anemic children tend to look very pale in color. They have cold hands and feet. They get easily fatigued. They can have headache and dizziness when they exercise. It also leads to poor growth and development. It causes poor appetite. Their scholastic performance tends to go down. Anemic young children and toddlers who are anemic, they tend to eat inedible items like they can chew on ice or dirt or even plaster off the walls. This is called pica, and it is a major symptom of anemia. Also, the children who are exposed to the children who are anemic, they tend to have decreased immunity and more frequent infections. Babies who are exposed to iron deficiency in the mother's womb or in early childhood also tend to have lower IQ scores. And even when we supplement with iron, this IQ does not reverse. So it is very important to diagnose anemia in children and also to prevent the onset of anemia in children. So let's now come to what are the strategies that we can adopt so that we can decrease the incidence of anemia in our children. The first thing is that during pregnancy, the mothers should be supplemented with iron supplements for at least 180 days during pregnancy. That is after the first trimester. Because this helps in building up the iron stores in the newborn. The second thing that should be done is they should exclusively breastfeed their babies for 4 to 6 months. Though the content of iron in breast milk is less, but it is much more bioavailable as compared to the other milks. So breastfeeding is good to prevent anemia in children. Thirdly, we should prophylactically supplement iron in babies, especially in premature babies in which the iron stores are low. So the supplementation is recommended from 2 weeks of age in low birth weight or premature babies. And in normal term newborns, we can give iron supplements from 4 to 6 months of age. Also, delayed cord clamping should be done when the baby is born because it gives some extra blood to the newborn and helps in building up the iron stores. Now we come to the most important thing to prevent anemia, which is the diet. So at 6 months of age, we should introduce complementary foods which are rich in iron. And not only in infants, even in children and adolescents, which are rapid periods of growth and there is increased requirement of iron, we should be giving at least 3 servings of iron-rich food and at least 1 or 2 servings of citrus or vitamin C-rich foods, because vitamin C helps in absorption of iron. So if we enumerate what food items are rich in iron, B12 and folic acid. Then your green leafy vegetables have good amount of iron. Also your legumes like chickpeas, kidney beans, sweet potato, your nuts and seeds, dates, raisins, jaggery. These are all iron rich foods. Also, in vitamins, if we look at foods which are rich in vitamin C, then it's tomatoes, oranges, your this bell peppers, guava. These are all rich in vitamin C. The B12 is found in poultry, in your dairy products, in fermented foods, and another thing is that your non-vegetarian food is also very rich in iron. So things like red meat, your chicken, egg, fish, these are good sources of heme iron. And heme iron is better absorbed as compared to the vegetarian sources of iron. Folic acid is also found in adequate amounts in your green leafy vegetables, also in your bananas and oranges. All these are rich, and beetroot, this is rich in folic acid. So we should really take care of the diet of children so that they get adequate amounts of iron. Other thing that should be done is we should deworm the children twice a year. So biannual deworming helps get rid of the parasites like hookworm and roundworms, which also lead to blood loss and anemia in children. Also, it is recommended that in the second year of life, we should not give too much milk to the children. So the milk intake should be restricted to 400 to 600 ml in the second year of life, because all these calcium containing products, they tend to impair the absorption of iron from your diet. And it is also recommended that we screen children for anemia at the age of 9 to 12 months in early childhood and adolescence, because these are periods of rapid growth and more iron requirement. And if we find that they are anemic, we should give them iron supplements in the proper dose and for a proper duration. Ideally, iron supplements should be taken empty stomach, and you should not be eating meals 1 hour before the iron supplement or 2 hours after taking iron. And it should not be taken with calcium containing, basically milk products. The government of India is also running a major program called the Anemia Mukt Bharat since 2018, aimed at decreasing the incidence of anemia in India. And I'm sure that if we all follow these preventive strategies, we can truly make India anemia free. Thank you.